Pelvic wall and floor. Anything, any idea about pelvic bone, pelvic wall, pelvic thing? Do you know these words before? No.
Yes, we know.
How?
Through medical.
Oh wow. Do you know some features of this bone? You are medical.
Yes, yes. Yes, yes.
Anterior superior iliac spine.
Where?
يا طلع.
That's the name. Here, Dicko.
Here.
How you know this is anterior?
Wisdom.
The pubic is anterior.
This.
Okay.
This.
This is anterior.
Yes. لا. Jim.
Come here.
كذا
Because there are small things I will demonstrate.
دقيقة.
We can make a circle, no problem.
كذا هذه lateral
هذه lateral, yes, of course. هذه lateral.
and
وبعد
I think like this.
This is Kyle's spine.
where?
This.
بطل
Yes,
الشارع
okay. Good, very good, very good.
هب
Hip bone, yes, very good. Hip bone. Iliac crest. Okay, good. So you know something. Good. Okay, let's start. Bismillah. We have two hip bones here. This is a hip bone. The general name is hip bone. It is composed of three bones separately, which are fused. Ilium, pubis, ischium. Okay, ilium, pubis, ischium. We have other pictures just to demonstrate. I am not here to demonstrate you the real bone. Why? Because this is not a part. This is a part of lower limb. So only those features I will touch which are with the pelvis. Okay. So generally this is a hip bone. When I combine two hip bones together, without this, when I combine two hip bones together, this is known as pelvic girdle. Pelvic girdle. And when I make a sacrum and coccyx with two hip bones, this is now bony pelvis. Again, one hip bone, another hip bone. When I combine both of them, this is known as pelvic girdle. Then we have sacrum and coccyx, and that will make a bony pelvis. These are extra vertebra. This is not the part of the pelvis. Okay, this is just to show you false pelvis above. Okay, just we should do broadly how and when, and then I will start the theoretical part. Okay, this is not the anatomical position. Sitting on, no. Actually, the anatomical position is like this. Okay, this anterior superior iliac spine and this pubic tubercle. They are not like this. They should be like in a vertical plane like this. So this is the real shape of the pelvis on side and in front. Agree? This is how it looks like. This is pelvis, bony pelvis. It's not like straight here. When we sit on this ischial tuberosities. These are the two bony prominences which are touching the ground. What structures are visible in this specimen or in this model? One hip bone, another hip bone, last lumbar vertebrae, 4 and 5. Then we have sacrum vertebra which are fused. So sacrum, in the sacrum we don't have intervertebral disc like I have here, because they are fused. Then after that we have a small coccyx. Okay. There is a small disc between coccyx and sacrum here. But again, these coccygeal and these sacrum, remember, they are fused. There is no intervertebral disc in the sacrum. That is the reason we call this as a sacrum bone separately. And then we have a coccyx. In the coccyx, we have vertebrae, of course, small, but they are fused together. They don't have intervertebral disc. Disc is still present between sacrum and the coccyx. These are two important points. Then, this is the front of the pelvis. This is on the back of the pelvis. This is lateral and anterior wall, lateral and anterior wall. You see that the anterior wall is lacking. It's not complete. So here it is complete by anterior abdominal muscles, the muscles of anterior abdominal wall. Agree? This is called as symphysis pubis. Symphysis pubis. This is one of the secondary cartilaginous joint. Who will tell me what is a secondary cartilaginous joint?
midline.
Okay, and
Does not move.
what is the character of why it is called secondary cartilaginous? What is primary cartilaginous? What is primary cartilaginous? Anyone? What is primary cartilaginous? When there is a bone, another bone, when they are connected with one cartilage, this is primary cartilage. When there is a bone, like here, symphysis pubis, one pubic bone, another pubic bone. Then we have two cartilages, one here, hyaline cartilage, and one here, fibrocartilage. This type of joint, of course, is present usually in the midline. This is the structure of a secondary cartilaginous joint. This is the structure of any primary cartilage.
Is it movable to sort of the secondary?
Very less, hardly. Okay, so for support, this is the main function. So, again, what are the parts? Ileum, pubis bone, ischium. Okay, ileum, pubic bone, ischium. This is known as obturator foramen. Obturator foramen. This is known as notch. Okay, here is ischial spine. Here is ischial tuberosity. This is how I hold this bone in my
Like gun.
like a gun. Okay, you can say. This is obturator. Don't mess with the Pakistanis. They are already on war. Don't tell us about guns. Okay, we know it. Okay. So this is obturator foramen. Okay. Greater sciatic notch, lesser sciatic notch. Greater sciatic notch, lesser sciatic notch, ischial spine. Anterior superior iliac spine, iliac crest, iliac fossa, outer surface, acetabulum for making hip joint. So these are the basics. Now, in this we have, okay, let's start with the theoretical part and then I will shift you to analysis. Most of the structures are SDL, most of the contents are SDL. But don't think that they are not coming in the exam. Of course. Okay, this is how we look at the pelvis. This is how we look at the pelvis in a 3D shape. What are the structures here? So let's start, Bismillah. This is the anterior part of the pelvis. Okay, pelvic bony pelvis. This is lateral and anterior. So this is lateral and anterior. This is sacrum. This is yellow is sacrum and this small is coccyx. I told you here is a secondary cartilaginous joint and here is another secondary cartilaginous joint. But of course there is one joint here, one joint here. I will classify the joints later on. This is roughly how we see the pictures in the paper and this is how we feel the pelvis in a 3D form maybe. Here are two last lumbar vertebrae because we have intervertebral disc and this is just to show you a part of the false pelvis. How it looks like? Okay, bony pelvis is formed by two hip bones, one here, one sacrum, one coccyx. This is the formation of your bony pelvis. Okay, orientation of the pelvic girdle. I told you at the start, the pelvis is not like straight like this. It is like anterior superior iliac spine and the pubic tubercle in same vertical plane like this. So this is not simply like this. It is a tilted and here is the cavity and this is sometimes known as J-shaped pelvis because it's tilted. So here we make a J. Okay, this is like we call this as the pelvic cavity. Then joints of the pelvis, what are the joints? Sacroiliac joint. Where is the sacroiliac joint? Here. Between sacrum and ilium, sacroiliac joint. Type of the joint, plain synovial. Ligaments are very easy here. Anterior and posterior interosseous sacroiliac ligament. Anterior here, posterior of the back. Then, symphysis pubis here. This is symphysis pubis. And I told you it's a secondary cartilaginous joint. Why it is a secondary cartilaginous joint? Because it has two cartilages. What are the two cartilages? One on the margin is hyaline cartilage and in between them is a fibrocartilage. So this is the reason it is known as secondary cartilaginous joint. What are the ligaments? One here superior, one here inferior. These are two ligaments which are supporting the symphysis pubis. Then sacrococcygeal joint here. Between sacrum and coccygeal joint here. This is a sacrococcygeal joint. Again, it has anterior and posterior. Anterior ligament, posterior ligaments. So this is how we have some ligaments with the formation of the pelvis. Now There are certain other ligaments. For example, two big ligaments are attached here. Sacrospinous ligament. From sacrum to spine. Small ligament like this. Sacrospinous ligament. And there is a big ligament, sacrotuberous ligament. Tuberosity. Sacrotuberous ligament. How they appear? They appear like this. See, this is greater sciatic notch. This is lesser sciatic notch. This is ischial spine. Why we are telling you these ligaments? Because this is a pelvis without any ligaments. But in real cadavers or humans, this is like attachment of the ligaments. So, this greater sciatic notch, which is just a notch here, is converted to a foramen, greater sciatic foramen. And here it is converted into lesser sciatic foramen with the help of two ligaments, sacrospinous and sacrotuberous ligament. What is sacrospinous? From sacrum to the spine, sacrospinous ligament. From sacrum to the ischial tuberosity, sacrotuberous ligament. This is how we have two extra ligaments, which are again included in the formation of boundary of the pelvis. Okay, sacrotuberous ligament, again, where it should be from sacrum to the tuberosity, sacrotuberous ligament. Sacrospinous ligament here. There are some other ligaments with the vertebral column, like posterior longitudinal ligament, like others, which are not with our objective at this moment. We are only concentrating towards the pelvis. Okay. So bony pelvis is divided into, now here, the bony pelvis is divided into oblique plane of pelvic inlet. Where is plane of pelvic inlet? Here. This is the plane of pelvic inlet. After this plane, this is a line of takhayul, a plane like this. This is actually the line or the plane which divides or separates the false pelvis above and a pelvic cavity inside, or the true pelvis. The pelvic cavity, after this plane, we call this as true pelvis. Above, this is false pelvis. What is the function of false pelvis? False pelvis is incomplete in front, like bony, but the anterior abdominal wall muscles, they cover it, like they are attached here, and they cover it. The head of the fetus has to go first to the false pelvis or greater pelvis, the same name, and then it will allow it to shift to the real pelvic cavity after crossing this plane, also known as pelvic brim. This is also known as pelvic brim. So we have oblique plane of pelvic inlet or pelvic brim, passing through the promontory of sacrum. This elevated part, this part of sacrum is called as promontory. The protruded part is called as promontory. Greater false pelvis above this plane, lesser or true pelvis below this plane, and the pelvic cavity, no problem. Understanding?
Yes.
This is how it looks like. Okay. If the pelvis is like this, we should have a diaphragm here to hold the viscera,
Yes.
because it should not be empty like this. So this is a pelvic diaphragm and it is present here like this. Am I clear now?
Yes. Yes.
So here you can see a pelvic diaphragm also. Pelvic diaphragm is what? Is a muscle composed of two parts. The muscles still have various type of fibers. This is again not in our objectives, but you should identify. See, here you see two different colors.
Yes.
The diaphragm is open in front, or it has openings. In males, 2 openings for urethra and rectum. In females, 3 openings, urethra, vagina and rectum. So this is how pelvic diaphragm is there. It supports the viscera. Plus, it's composed of 2 big muscular part areas, levator ani and coccygeus on the back. These are the 2 muscles of pelvic diaphragm itself. There are 2 muscles on the pelvic wall also. So, the diaphragm is here. Pelvic diaphragm is here. Here, if I remove the pelvic diaphragm, covering the obturator foramen, we have obturator interus muscle, and here on the back, we have piriformis muscle. These are the 2 muscles which will make the muscles of the wall itself. The muscles of diaphragm are levator ani and coccygeus. Clear? I will describe it in a couple of slides more. Okay, where is the true pelvis? Here is the true pelvis. This is the true pelvic cavity. This is the pelvic inlet. When we say inlet, it means head of the fetus is coming. The pelvic outlet, the head of fetus is going out for delivery. And this is the pelvic cavity. Okay? You can see the contents of pelvic cavity from anterior to posterior. This is pelvic inlet, this is pelvic outlet. Where is the plane? This is also known as pelvic brim. This is pelvic outlet. This is pelvic cavity. Clear?
What separates the false pelvic than the abdominal?
Again.
What separates the false pelvic than the abdominal cavity?
Nothing.
So,
Here is the only plane
yes.
which separates
False and true.
the false and true. Above this is of course abdominal cavity. Below this is actually the pelvic cavity. Below this is actually the pelvic.
False pelvic is the same as
the pelvic brim
Yes.
separates the abdominal cavity from pelvic cavity.
Okay.
And this is an imaginary plane. There's nothing like present like this. Not a sheet or nothing like that. Okay? This is just a plane which we think it's there.
Doctor,
Now clear?
what is the purpose dividing from?
Just for classification. Just for classification and delivery purposes. No other anatomical subdivisions like there is a band or there is a structure like some sheet or something. No. Okay. Pelvic brim shape, triangular or heart shape here. This is triangular or heart shaped in males. Okay? Heart like the ARY heart. Okay. This is like this heart, which you give us in. So here is the pelvic inlet, triangular or heart shaped in the males, but transversely oval in females. We are focusing now on how the pelvis of male and female they differ. Okay. The boundaries, promontory, this is the promontory of sacrum. Then we have behind arcuate line on the ilium bone. From here, ilium bone. This is known as ala of the sacrum. Ala of the sacrum. From here, ilium starts. So ilium bone, this is known as arcuate line. Then we have pubic bones here from this part. This is a pubic bone on either side. This is known as pectineal line. Sometimes also known as iliopectineal line. This is also known as iliopectineal line. If you separate for two bones separately, for ilium, this is known as arcuate line, and for pectineal, for pubic bone. Collectively, we can call this as iliopectineal line as well. Finishing in the upper margin of symphysis here. This is actually the inlet. So, where is the inlet actually? Actually, inlet is composed of promontory. Here, symphysis pubis. On two sides, iliopectineal line, which is composed of two parts, part on the ilium, part on the pubic bone. Now clear? Yes. Good. This is to show you ilial and here. This is pubic bone, this is pectineal line, arcuate line, collectively also known as iliopectineal line. Some books say iliopectineal line, and that is also a very valid nomenclature. Very valid. Okay, pelvic outlet. Where is pelvic outlet? If I remove the diaphragm, this is pelvic inlet, this is pelvic outlet. Okay, it's a diamond shaped space. When I say diamond shape, it means it's like this. This is the anterior angle, posterior angle, lateral two angles, anterior and lateral margins or boundaries. So, diamond shape, anterior angle here. Made of what? Inferior pubic ligament, because it is covered with the pubic ligament like this. Then, posterior tip of the coccyx here. Lateral angle, one here, one here. Ischial tuberosity. This is ischial tuberosity, this is ischial tuberosity. Then, anterior lateral side. Anterior lateral side. Ischiopubic ramus, this and this. Collectively also known as pubic arch. Where is pubic arch? This is pubic arch. This is pubic arch. So here, iliopubic. So this is pubic arch. Here. Ischiopubic ramus. Why I say ischiopubic ramus? Because it's between ischium bone and pubic bone. Ischiopubic ramus, ischiopubic ramus. This is anterior lateral and posterolateral here, here and here. Sacrotuberous ligament. I told you sacrotuberous ligament is a ligament which is connecting from sacrum to the ischial tuberosity. So this is how we have pelvic outlet. This is known as pelvic outlet. Pelvic cavity. Where is the pelvic cavity? It's a ball-shaped structure like this, which I placed inside the pelvis. Where is the pelvic diaphragm? It should be here. Understand? So this is what we called as pelvic cavity. This is now pelvic inlet. This is now pelvic outlet, and here is J-shaped pelvic cavity. Okay? Why I'm saying inlet, the boundary, the level is at valgus nerve. Symphysis pubis, promontory, and iliopectineal line on the sides. Pelvic inlet, outlet here. Now you know the inlet, outlet, and the cavity. Let's see what are other things available here. Okay, the big differences. This chart is very important for you. Big differences between male and female pelvis. Generally, the male pelvis are rough and heavy and thick bones. Why? Why they are heavy and thick? The male bones are heavy, number one. Number two, the male bodies are more muscular, so there are more bony prominences available on a real bony pelvis. In males, they are less prominence and they are lighter in weight. Inlet, heart shape or narrow, like this, and transverse oval wide, like this, inlet. Cavity, deep. Here we have shallow cavity. Outlet, narrow, inverted. When I say inverted, this is outlet. And when I say inverted, it's like this. When I say everted, it's like this. Like inversion and eversion of my foot. So this is inverted, this is everted. So in males, we have a bit inverted, and just to help you, I write not inverted ischial spines, ischial tuberosities, wider and inverted. Acute angle, this is a very important sign here. Subpubic angle or pubic arch. Remember this picture, this figure. In males, it's like this. In female, it's wider, like this. Okay? So this is how you guess it's a male pelvis or it's a female pelvis. Obturator foramen. Obturator foramen. Round, oval. Not very clear, but once you see 5-6 pelvises, you will find the difference. Acetabulum, large and more stability for males and less small for females. Sacrum, long, narrow sacrum. This sacrum. I don't have a sacrum. In the lab, I will tell you. The sacrum separately is long, narrow, and more curved anteriorly. Short, wider, and less curved, like on the back. So, why these adaptations for female?
Pregnancy.
Because we have, yes, because we should have a good space to enter the head of the fetus and the fetus itself. Then we should have a good cavity to stabilize. And then we should have a big outlet, less curved, mostly everted, so that the head can deliver very safely. This is how we have certain differences between male and female pelvis. This is like the pubic arch like this and pubic arch like this. The angle is here roughly 90 and here roughly more than 90 in males and females. Pubic arch. Okay, these are also some differences, nothing new here, except you know here the angle now. Male angle, female angle. So this is like male and female angle. Tilted and other things I have explained to you. There's nothing new here in this slide. Okay, another slide showing you some more differences or some practical differences for. So female pelvis, big inlet, big cavity, and big outlet. So think like a ball, yani fetal head, entering and coming out here. So it's very simple. As compared here, there is nothing like. So these adaptations or these differences or these features for the female pelvis are especially for the delivery purpose. And the angle you must remember like this. We have bony pelvises in the lab, male and female, and I will tell you. Okay, pelvic diaphragm. Where is pelvic diaphragm? Here. We have two diaphragms now here. One is the real diaphragm which we use for respiration. If I have a raised intra-abdominal pressure, the organs will prolapse down.
Yes.
To hold, to make a counter resistance. Pressure from above, pressure from below. That is the real thing which is provided by a pelvic diaphragm. And pelvic diaphragm, I told you, where is pelvic diaphragm? Pelvic diaphragm is like this, a structure which is open in front, or I should not say open, it has areas for penetrating or passing through of the genitals and urogenital tract, and this is the rough location of pelvic diaphragm. It appears like this. It is composed of two big muscles, levator ani and coccygeus. Levator ani and coccygeus muscle. How it looks like? It's roughly at this level in males, in females both. Here in males we have two openings for urethra and one for rectum. In females we have three openings, one for urethra, vagina and then the rectum. But still, if after multiple pregnancies, trauma or surgery or something, the pelvic diaphragm can become weak. And you have heard the term known as uterine prolapse. What is uterine prolapse? When the uterus is sagging down and may appear even outside. This is known as uterine prolapse. This is how it looks like, pelvic diaphragm. What are the components of pelvic diaphragm? Here, if you can see these, my words I have typed here. Okay, this all red part is levator ani muscle with openings here, of course, for the urogenital tract. Then on the back we have green coccygeus muscle. So here is levator ani, coccygeus. What is beyond? This is pelvic diaphragm. What is after that? Here, this one on the back is piriformis muscle. Piriformis muscle is coming from here. It will enter the lower limb. Okay, it's present here. Piriformis muscle is arising from sacrum, but it will get out of greater sciatic foramen and it will go to the lower limb. So this is piriformis, and covering the obturator foramen, we have obturator. Here is obturator foramen. Here we have obturator internus muscle, obturator externus muscle. Externus is not a part of pelvis. Usually we don't classify. So what are the parts of pelvic diaphragm? Levator ani and coccygeus. What are the muscles of the boundary of the pelvis? Two. Again, obturator internus and piriformis. Am I clear?
Yes.
Can you repeat the name of muscles?
Yes, we have two big muscles here. This is the location of pelvic diaphragm. Pelvic diaphragm itself is composed of two muscles. The pelvic wall, another two muscles. Pelvic diaphragm, levator ani, LA, I write here. Don't mix it with Los Angeles. So, levator ani and coccygeus. This is pelvic diaphragm and pelvic wall behind piriformis, anterior-laterally obturator internus. Am I clear now?
Yes.
This is how the pelvic diaphragm looks like in different positions. From inside, from a bit of 3D picture, you have levator ani, you have coccygeus, you have piriformis, and you have obturator internus. Is this clear? I hope.
Yes. Very clear.
How they look like on an outlet? They should look like this on an outlet. Okay? So, this is an outlet. What are the parts of the outlet? Symphysis pubis, tip of the coccyx, ischial tuberosity, pubic arch, and sacrotuberous ligament. And here is the levator ani, here is coccygeus, here is piriformis, here is obturator internus. Am I clear of
Yes.
the same structures here?
Yes.
Okay. This slide is for perineum actually, but it is just giving you a concept how these structures are there. Where is pelvic diaphragm? This is the boundary of the pelvis here. This is bony pelvis. Just to give you an overview, because the next topic is perineum with you. Where is perineum?
Below the diaphragm.
Yes, here. This is pelvic diaphragm. Anything below the pelvic diaphragm, between the two thighs, all this is in the perineum. So here is the pelvic diaphragm. Here is pelvic diaphragm. Another diaphragm is present here, urogenital diaphragm. In the perineum you will cover. Where is perineum? Actually here on the back, on the base. So there are other perineal areas, perineal pouches, perineal places, and we will give you, this is just to give you an overview of the perineum. It's not a related slide with pelvis. This is very clear now?
Yes.
This is how pelvic diaphragm is present. Levator ani, coccygeus. Is it clear? Levator ani, coccygeus. So pelvic floor diaphragm is made of levator ani and coccygeus, and pelvic wall obturator internus and piriformis on the back. This is how we look like on various aspects. Let's identify the muscles now again. Piriformis on the back,
Yes.
obturator internus. Always remember, with the obturator internus, we have a foramen here. Obturator foramen. Okay? In the real models or in real cadavers, I will show you in the lab in a couple of minutes later on. You will find a foramen and it lodges what?
Obturator band. Vein.
Obturator.
Obturator nerve. And we have some cadavers showing obturator nerve passing through. So obturator foramen is a sign of, is a location of. Okay. This is the same thing, nothing new here. Then, okay. The nerve supply, the actions, the other things for pelvic diaphragm is not with us. They have been shifted to the lecture of perineum. So I'm not going into detail. So just you have to identify the structures. What are the structures here? You can identify now very clearly. Where is the anterior aspect? Here or here? Anterior aspect, symphysis pubis. Always think of symphysis pubis and sacrum. Where is sacral promontory? Here, sacral promontory.
Yes.
This is symphysis pubis. This is lateral wall,
Yes.
iliac bones, and okay. Now, where is this is a male pelvis, female pelvis.
Female.
Female.
We have three openings.
Yes.
Okay. Here, levator ani.
Yes.
Here, coccygeus. Here,
Piriform.
piriformis. Here, obturator
Obturator.
internus with
Covered by obturator.
Obturator foramen.
obturator. Good.
What is this muscle between the piriformis and the visceral?
This one.
Yes.
This all is levator ani. It has three types of fibers: front fibers, side fibers, and like. We will classify them later on, but not here. Okay. So these are all different types of fibers of levator ani. There are many pictures, but I don't bring intentionally because I don't want to confuse you. Just think this is a pelvic diaphragm composed of two muscles. But again, the levator ani has three parts later on.
Okay.
Here piriformis, here obturator internus, here obturator foramen. Am I clear?
Yeah.
Yes. Okay. Now things are being labeled here. Good. Piriformis. Here is the coccygeus. This all is
The visceral eye.
levator ani. Okay. What does this white line say? Story. They say there is a white line. This is known as a white line. Here we have obturator fascia, which is covering the pelvic cavity. This white line is the tendinous origin of levator ani muscle. So this is a fibrous band. So what is this white line? Here I write for you. The tendinous arch or white line is a thickening of fascia covering obturator internus muscle actually, or obturator fascia, and extends between the levator, between the lower part of pubic body and ischial spine. This is known as white line. We can see in cadavers. I will try to show you inshallah. What muscle?
Piriform.
Yes, piriform.
Piriformis.
In the back.
What
Obturator.
muscle?
Obturator.
Internus. Can you see the foramen?
Yes.
Good.
Coccygeus.
The visceral eye.
Levator ani. Good. A side view. Okay. There are different types of pelvis even in female. Okay. When it's a typical female pelvis, which I described to you, this is known as gynecoid pelvis. It's very classical and this is a very suitable for female and delivery purposes. The typical gynecoid pelvis is the real pelvis. Still, it is only in 41% of the cases. So other cases, we need some surgeries or something. Android pelvis, like your Android phones. Android is like female pelvis looking like a male pelvis. Constricted, inverted, small cavity. If they have features like if a female has a male-like pelvis, this is known as android pelvis. And this is look like, see, the female pelvis, big cavity, big inlet, small cavity, small inlet.
Like how?
Yes, look like male pelvis. If I don't write anything and I ask what is this pelvis, you will say male. You will see female pelvis, you will say male pelvis. So this is how you look like. Then the giga. Anthropoid pelvis. Anthropoid is the animal. Think of a cow or a goat. So pelvis is like prolonged, like anthropoid. And platyploid, yani flat pelvis. Another name is flat pelvis with long transverse diameter. Yes.
The android pelvis, they can have a normal delivery?
No, usually not. So ideally speaking, only 41% of they are have typical gynecoid pelvis, and they have a very suitable type of delivery. Understanding? Yes.
I'm confused. Is that same as male?
Yes. Define android pelvis. Android pelvis is a female pelvis, is a type of female pelvis which has features like male pelvis.
Everything.
Some features. Not exactly all the male features. Some male features may be small cavity, maybe inverted spines and inverted ischial spines. You know this all? Okay. This is a side view of the pelvis. What is this? Symphysis pubis. So this is the front here, and this is the sacrum and coccyx. This is all levator ani.
Yes.
Behind coccygeus, behind piriformis. What is this white structure?
White line?
Nerves. No.
Oh.
Nerves. Sacral plexus here. The muscle is on the back. I can't show you here. I will show you on the cadavers and plastic models down in the lab. Here we have muscle, and on the muscle we have sacral plexus, so these areas are visible. Where is the white line?
Between the veterani and the twital.
No.
There's the white line. Understand?
Yes.
Okay. Everything is labeled just to, what is X?
Veterani.
Levator. Here.
Veterani.
See, this is actually the pelvic inlet in a plastic model. I can see the urogenital structures. I can see symphysis pubis, promontory, lateral wall of the pelvis, levator ani muscle. Where is coccygeus?
Above.
Here.
Yes.
Here, coccygeus. Where is piriformis? Here on the back. And here you can see nerve plexus getting out. Here is the white line. Here and here. I will show you more. Oh, sorry.
This
No,
white line.
this is the white line. I'm sorry. Here. It should be here. This is the white line. I'm sorry. That is the. Initially, I told you the gap between levator ani and coccygeus. This is another model showing you what are the structures visible here.
Diaphragm.
The pelvic whole of the pelvic diaphragm. Okay, symphysis pubis, levator ani, urogenital exits, white line, piriformis, levator ani. Where should be obturator internus?
Lateral.
Sides.
Here.
Yes.
Where should be the piriformis? On the back. Good? Pelvic diaphragm, which I told you. Nothing new here. This is a real cadaveric specimen. I will show you in a couple of minutes down, inshallah. This is another cadaveric specimen. Another male cadaveric specimen.
Male, female.
Male is left.
Male yasar.
Male
Good.
left, yes.
How?
The angle.
The best thing, yes. The best thing is the angle. So don't tell anyone, write in the exam very comfortably, like this angle 90 or more, 90 or near 90, and here is more than 90.
90.
So this is the best thing. Plus, what are the other features? Heavy and bony margins and everted, not inverted. Everything.
Inverted the female, doctor.
Yes.
Inverted.
Yes. Inverted mostly in males.
Yes.
Okay. See the angle?
Yes.
Now see the angle. See this angle? See this angle. Okay. This is a hip bone. I told you many of the parts. So this is ilium bone. It's composed of 3 bones. Ilium bone, pubis bone, ischium bone. Where are some features? This is how to hold the hip bone, anterior superior iliac spine, pubic tubercle, iliopectineal line. It is composed of two parts. Part on the ilium, another name, and here pectineal line. Collectively, we sometimes call this as iliopectineal line. Okay, this is a margin of pelvic inlet.
Yes.
Pelvic.
Lateral.
Yeah, this is the lateral margin of pelvic inlet. On the back, here we have promontory. I will show you in the lab, no problem. Yes,
What's the difference between pubic tubercle and iliac ischial tubercle?
very good. Not ischial tuberosity. Anterior superior iliac spine and here. This is the inguinal ligament here. Inguinal ligament is attached from anterior superior iliac spine to the pubic tubercle. In the lab, we have other specimens. I will tell you all the ligaments. I will show you all the ligaments, inshallah. No problem. Okay. These are some parts of ilium bone. Sacrum, I will demonstrate you because I don't have sacrum here. But just to have a general information about sacrum, this is the front view, this is the back view. It's composed of 5 sacral vertebrae, S1, 2, 3, 4, 5. After that, we have a sacrococcygeal joint. It's again a secondary cartilaginous joint. Then we have coccyx. These are known as sacral foramina. Anterior and posterior both. Sacral foramina for emerging of nerves. Where is sacral canal? Here is the sacral canal where the spinal cord will end and the other structures along with. And here is the area for getting out of the nerves. This is base of the sacrum. The sacrum is a triangular bone like this. So here is the base, here is the apex. It's down. So apex is here. Apex of the sacrum, making joint here. Then we have superior articular processes for the L5 to attach here. On the back, we have a median line, a sort of, an intermediate and a lateral line. They are known as median sacral crest, intermediate sacral crest, lateral sacral crest. These bony features are variable. I have selected one real bone for you in the lab. We will see the features. Here we have sacral hiatus, opening. Hiatus means opening.
So must we identify if it is a male or a female in the example?
Actually, yes, I have put a lot of slides here because initially they told me this is a part of the objective. But now they told me this is not a part of objective. So please follow the objectives carefully. Okay? If this is not the part of objective, leave it, the sacrum. This I created this table for how to find the differences of sacrum. If this is your objective, please. If not,
Leave it.
consider a gift. Thank you very much.
Thank you.
Jazakallah khair. I hope you understand something.